Welcome back to Inkmed. We have already covered the first 20 high-yield respiratory clinical scenarios. In this video, we will discuss scenario 20 to 21 to 30, focusing on pleural disease, pulmonary embolism, good passage syndrome, and bronchogenic carcinoma, pulmonary edema, and other frequently tested concepts. As always, focus on the trigger words because in the entrance exam, one or two keywords are enough to identify the diagnosis. Let's begin. A patient has a large pleural effusion with a stony dullness on percussion and decreased word sound. So diagnosis pleural effusion. The trigger words is stony dullness, decreased breath sound, and large pleural effusion. How to remember? Whenever fluid collects around the lung, sound transmission decreases. No air means no bird sound. Fluid means stony dull percussion. The trick is fluid falls silent. The fluid in pleural space equals decrease the bird sound. Example: pleural effusion causes stony dullness, whereas pneumothorax causes hyperresonance. Next, the pleural fluid analysis shows an exudative effusion, lymphocytic predominance, and ADA more than 40 U/L. Diagnosis: tuberculosis pleural effusion. Trigger words: exudative effusion, lymphocyte predominant, ADA more than 40. A trick: remember the 3 T's: TB, T cells, lymphocytes, tall ADA. Whenever you see those together, think TB. Example: high ADA lymphocyte rich pleural fluid is favorite NEET PG and Upsc Cms question. Next, a patient suddenly develops dyspnea, pleuritic chest pain, and has elevated D-dimer. Diagnosis: pulmonary embolism. Trigger words: sudden dyspnea, pleuritic chest pain, and elevated D-dimer. How to remember? A clot suddenly blocks the blood flow to the lungs. Sudden symptoms should be immediately raise suspicion. The trick is sudden plus D-dimers. Don't miss pulmonary embolism. Example: D-dimers is sensitive but not specific. CT pulmonary angiography confirms the diagnosis. Next, a patient presents with severe dyspnea, hypotension, syncope, and CDPA shows a saddle embolus. His diagnosis: massive pulmonary embolism. The trigger words are saddle embolus, hypotension, and syncope. The trick is imagine the clot sitting like this saddle over the pulmonary artery. The large clot causes severe obstruction leading to shock. The example: the massive pulmonary embolism causing the hemodynamic instability requires immediate thrombolysis unless contraindicated. Next, the young woman presents with hemoptysis, hematuria, and anemia. The diagnosis is good passage syndrome. Trigger words: hemoptysis, hematuria, young patient. How to remember? Think of lung plus kidney disease. Blood from lungs, blood from kidney. The trick is good passage attacks good lungs and good kidneys. Example: anti-GBM antibodies are characteristics. Now let's move towards a pulmonary malignancy, pulmonary edema, thromboembolism, and pulmonary renal syndrome. A patient has chronic cough, blood-streaked sputum, and an upper lobe cavitary lesion. Diagnosis is bronchogenic carcinoma. The blood-streaked sputum, chronic cough, cavitary lesion. Memory trick: not every upper lobe cavity is TB. If hemoptysis is persistent, especially in the old smoker, always think lung cancer. Example: persistent cough with unexplained hemoptysis should always be investigated for malignancy. A patient has orthopnea, paroxysmal nocturnal dyspnea, pink frothy sputum, and bilateral basal crepitation. Diagnosis is acute left ventricular failure causing pulmonary edema. The trigger words are orthopnea, PND, pink frothy sputum, basal crepitation. The trick is left ventricle fails. The blood backs up into the lungs. Fluid fills the alveoli. The memory trick: left fails, lungs folded. The example: pink frothy sputum is one of the most classical clues of pulmonary edema. Next, the patient suddenly develops pleuritic chest pain, hemoptysis, and the risk factor like immobilization, oral contraceptive pills, or recent surgery. Diagnosis: pulmonary thromboembolism. The trigger words are immobilization, surgery, OCPUs, hemoptysis, sudden chest pain. The memory trick is remember Virchow triad. The triad is stasis, endothelial injury, hypercoagulability. These are the major causes of pulmonary embolism. Example: always ask about recent travel, surgery, fracture, pregnancy, or prolonged immobilization. Next, a patient has a chronic cough, clubbing, weight loss, and coarse basal crackles. The diagnosis is bronchitis. Trigger words: clubbing chronic pruritic cough and course correctors. Trick: the bronchitis means permanently damaged bronchi. Damaged bronchi repeatedly gets infected. Repeated infection causes clubbing. Example: clubbing is the commonest bronchitis but uncommon in uncompleted asthma. Next, the patient has progressive dyspnea, periodontal puffiness, smoky urine, and hypertension. The diagnosis is pulmonary renal syndrome due to the good passage syndrome. Trigger words: smoky urine, periorbital edema, progressive dyspnea. The trick is whenever lungs and kidney are affected together, think pulmonary renal syndrome. One of the most important causes is good passage syndrome. Example: good passage syndrome can initially present with pulmonary symptoms before renal manifestation become obvious. Before you leave, here's something that can genuinely help your preparation. We are conducting free daily tests exclusive for serious aspirants on our WhatsApp channel. At 1 o'clock p.m. NEET PG daily test, at 2 o'clock p.m. Upsc Cms daily test. To keep the discussion focused, only the first 50 participants are allowed in each test session. The topic for each day test is announced in advance in our WhatsApp channel and Instagram page, so you can revise before attempting the test. If you are serious about improving your rank, join the channel, turn on notification, and don't miss the daily practice. If you found this video useful, like it, share it with your friends, subscribe to Inkmed. Thank you for watching.